What if I told you that a single pill could not only improve your sexual performance, but also protect your heart, help with blood pressure, and even support prostate health? Sounds almost too good to be true, right? Here's the shocking truth. Over 300 million men worldwide struggle with erectile dysfunction, and yet most of them don't know how medications like Tadalafil actually work inside the body. Some even take it the wrong way, risking serious side effects without realizing it. In this video, we're going to break down exactly how Tadalafil works, step by step, in simple language. We'll uncover its surprising benefits beyond the bedroom, the dangers you need to watch out for, and the biggest mistakes that could make the pill completely useless for you. And stay with me until the end, because I'll reveal the #1 deadly mistake people make when mixing Tadalafil with another common medication, something that can literally stop your heart. So, how does a small tablet manage to change blood flow, improve performance, and even influence your overall health? Let's find out. Tadalafil is a medication that belongs to a group of drugs called PDE5 inhibitors. You may know it by its brand name, Cialis. Unlike other erectile dysfunction drugs that only last a few hours, Tadalafil is often called the weekend pill because it can remain active in the body for up to 36 hours. But here's the important part. Tadalafil was not created only for sexual health. In fact, doctors also prescribe it for benign prostatic hyperplasia, BPH, a condition where the prostate grows and makes urination difficult, and for pulmonary arterial hypertension, which is dangerously high blood pressure in the lungs. So when we talk about Tadalafil, we're not just talking about a performance enhancer. We're talking about a scientifically designed drug that has multiple applications in human health. Quick question for you. Did you know Tadalafil was originally developed for heart-related conditions before becoming famous for erectile dysfunction? Drop your answer in the comments. I'll be reading them. But here's the big mystery. How does Tadalafil actually work inside your body? What happens after you swallow the pill that allows more blood to flow where it matters most? That's what we'll uncover in the next chapter. To understand how Tadalafil works, we first need to look at what happens during a natural erection. When a man is sexually stimulated, the body releases a molecule called nitric oxide. This molecule triggers the production of another substance known as cGMP, and cGMP is the real star here. It relaxes the smooth muscles in the blood vessels of the penis, allowing them to open up. When those vessels expand, more blood flows in, and that's what causes and maintains an erection. Now, here's the catch. The body also produces an enzyme called PDE5. Think of PDE5 as the eraser that breaks down cGMP. The problem is, if PDE5 works too fast, the erection disappears before it even properly starts. This is where Tadalafil steps in. It blocks PDE5 from breaking down cGMP. With PDE5 temporarily out of the way, cGMP levels remain higher for longer. The result? Stronger and more sustainable blood flow to the penis during sexual stimulation. But there's something most people don't realize. Tadalafil doesn't create an erection on its own. Without sexual arousal, it won't do anything. It simply helps the natural process work much more effectively when the right signals are already there. Quick reality check. This is why some men mistakenly believe Tadalafil isn't working for them, when in fact, they just weren't sexually stimulated enough. But here's where it gets really fascinating. Tadalafil's effects go far beyond the bedroom. Because blood vessels are everywhere in your body, the same mechanism can also help other organs. And that leads us directly into our next chapter. Most people think Tadalafil is just about sex, but science has uncovered powerful benefits that extend way beyond the bedroom. Prostate health men over 50 often face benign prostatic hyperplasia, BPH, an enlarged prostate that makes urination frequent, urgent, and sometimes painful. Tadalafil relaxes smooth muscles in the prostate and bladder, making it easier to urinate. Many men who take it for erectile dysfunction notice their bathroom visits at night drop dramatically. Pulmonary arterial hypertension, PAH. This is a serious condition where blood pressure in the lungs is dangerously high. By widening blood vessels, Tadalafil eases pressure on the lungs and the heart, improving breathing and exercise capacity. For some patients, it's literally literally a lifesaver. Cardiovascular support. Although not yet fully mainstream, studies suggest Tadalafil may improve blood vessel flexibility and circulation, potentially reducing the risk of certain heart problems. Remember, it was first developed as a heart medication before becoming famous for ED, mood and confidence boost. This one is often underestimated. Men who regain sexual function frequently report higher confidence, reduced anxiety, and even improvements in relationships. The mental health benefits are real and profound. Here's the surprising takeaway. Tadalafil is not just about improving performance, it's about improving quality of life. But before you rush to think it's a miracle drug, remember, every medication comes with side effects, and that's exactly what we'll explore in the next chapter. No drug is free of side effects, and Tadalafil is no exception. The good news? For most people, the side effects are mild and temporary, but it's still crucial to understand them. Here are the most common ones reported. Headaches. This is the #1 complaint. Because Tadalafil widens blood vessels, it can cause a rush of blood that triggers headaches in some users. Flushing. Some men notice a warm red face or neck shortly after taking it. This usually passes quickly. Indigestion or stomach discomfort. Since it affects blood flow, it can sometimes irritate the digestive system, leading to bloating or acid reflux. Back pain and muscle aches. A unique effect of Tadalafil compared to other ED drugs, these aches usually appear 12 to 24 hours after taking the pill and fade within 48 hours. Nasal congestion. That stuffy nose feeling is simply due to blood vessels expanding in the sinuses. Most of these side effects are not dangerous, but they can be uncomfortable. What's more important is knowing the difference between common side effects and dangerous warning signs. Here's the cliffhanger. Some rare side effects of Tadalafil can be life-threatening, and ignoring them can cost you your health or your life. While most side effects of Tadalafil are mild, there are a few red flags you must never ignore. These are not just inconveniences. They are medical emergencies. Priapism, prolonged erection. If you experience an erection lasting more than 4 hours, this is not a sign of extra strength. It's a dangerous condition that can cause permanent damage to the penis. Immediate medical attention is critical. Sudden vision changes. Rarely, Tadalafil can reduce blood flow to the optic nerve, leading to blurred vision or even sudden vision loss. If this happens, stop the drug and see a doctor immediately. Hearing problems. A sudden decrease or loss of hearing, sometimes with ringing in the ears, has been reported. This is rare, but it requires urgent care. Chest pain or severe dizziness. This could mean Tadalafil is dangerously interacting with your heart or blood pressure. Remember, it lowers blood pressure, so if combined with other medications, the drop can be too extreme. Severe allergic reactions, difficulty breathing, swelling of the lips, tongue, or throat, though extremely rare, can be fatal if ignored. Here's the big danger most people don't know. Combining Tadalafil with certain medications, especially nitrates, often prescribed for chest pain, can cause blood pressure to drop so fast it leads to collapse, heart attack, or even death. And yet, many men are unaware of this risk and take the combination without realizing the consequences. In the next chapter, we'll talk about the most common mistakes people make with Tadalafil and how you can avoid turning a helpful medication into a dangerous one. Even though Tadalafil is a powerful and effective medication, many men use it in ways that either reduce its effectiveness or increase the risk of harm. Let's break down the biggest errors. Taking it without medical guidance. Many buy Tadalafil online or from unreliable sources without a prescription. Not only is this dangerous because of fake pills, but it also skips the essential step of checking for dangerous drug interactions, expecting instant results. Some men take the pill and think an erection should appear immediately. Remember, Tadalafil only works with sexual stimulation. Without arousal, nothing will happen. Mixing it with alcohol. A glass of wine may not be a big deal, but heavy drinking combined with Tadalafil can lower blood pressure too much, leading to dizziness, fainting, or even collapse. Combining with nitrates or poppers, this is the deadliest mistake. Mixing Tadalafil with chest pain medications, like nitroglycerin, or recreational drugs like poppers can cause a catastrophic drop in blood pressure. Ignoring dosage instructions. Some think, if one pill works, 2 will work better. Wrong. Higher doses don't increase pleasure, they increase risk. Overdosing only raises the chance of severe side effects. Not considering timing. While Tadalafil can last up to 36 hours, it doesn't mean you're ready the whole time. It simply means your body is more responsive during that window. Expecting constant readiness is unrealistic. Here's the key lesson. Tadalafil is safe and effective when used correctly, but the margin for error is small if you're careless. So, how can you make sure you're using Tadalafil the right way, maximizing benefits and minimizing risks? That's what we'll uncover in the next chapter. If you're going to use Tadalafil, the goal is clear. Maximize the benefits while keeping risks as low as possible. Here are the key steps every man should know. Consult a doctor. First, this isn't just a formality. Your doctor will check for heart disease, blood pressure issues, and medications that may interact dangerously with Tadalafil. Start with the right dose. Tadalafil is usually prescribed in doses from 2.5 milligrams to 20 milligrams. Lower daily doses are often used for men with both erectile dysfunction and prostate problems, while higher as-needed doses are used for sexual activity. Never adjust the dose without medical guidance. Time. It's smartly Tadalafil doesn't work instantly like some other ED drugs. Take it at least 30 minutes before activity. But remember, its effects can last up to 36 hours. This gives you flexibility and less pressure to perform on schedule. Avoid heavy alcohol. 1 drink? Usually fine. Several drinks? Dangerous. Alcohol plus Tadalafil, increased risk of dizziness, fainting, or low blood pressure. Be patient with results. Some men don't see immediate success the first time. It may take a few tries for the body to adjust. Consistency and patience are key. Monitor your body, pay attention to how you feel. Headaches, flushing, or mild back pain may be normal, but chest pain, vision changes, or prolonged erections are emergencies. Lifestyle matters too. Don't forget, Tadalafil works best when combined with healthy habits. Exercise, balanced diet, quitting smoking, and managing stress all improve results. Think of Tadalafil as a tool, not a magic bullet. It helps your body, but your lifestyle choices determine how well it truly works for you. And now, for the final chapter, we'll bring everything together. How Tadalafil can transform not just your performance, but your long-term health and confidence. By now, you've learned that Tadalafil is far more than just a pill for performance. It's a medication that works at the deepest level of blood flow, helping millions of men not only regain sexual confidence, but also improve urinary symptoms, lung function, and even quality of life. Here's what to remember. Tadalafil works by blocking the PDE5 enzyme, keeping blood vessels open, and allowing stronger, longer-lasting erections, but only with sexual stimulation. Its benefits extend to prostate health and pulmonary hypertension, making it a truly versatile medication. Side effects are usually mild, but the warning signs like chest pain, vision changes, or prolonged erections should never be ignored. The most dangerous mistake? Mixing Tadalafil with nitrates or certain recreational drugs, a combination that can literally stop your heart. Safe use comes down to consulting your doctor, following the prescribed dose, avoiding excess alcohol, and making lifestyle choices that support your health. Think of Tadalafil not as a shortcut, but as a partner in your health journey. A tool that, when used responsibly, can give you back control, confidence, and vitality. Now, I want to hear from you. Have you or someone you know experienced the benefits or the challenges of Tadalafil? Share your story in the comments. Your experience might help someone else watching right now. And if you found this video valuable, don't forget to like, share, and subscribe, because in upcoming videos, we'll explore the hidden connections between sexual health, heart health, and longevity. And remember the promise from the beginning? Here's the final revelation. The deadliest mistake is combining Tadalafil with nitrates. This single error has led to countless hospitalizations worldwide, and yet it's completely preventable if you stay informed. Take care of your health, make smart choices, and I'll see you in the next video.